Start recording. Yes. Good evening, everyone. My name is Niels Ribeiro Yamofio, and I am the Chief of External Affairs for DC Prep. Excited to connect with our students, our families, our staff, our alumni, and friends of DC Prep, specifically around the topic of COVID. So COVID has and continues to have an unrelenting impact on the city, country, and planet for over a year. And during that year, we have been receiving ever-changing updates, information, policies, etc. I personally have found it difficult to keep up between what is and isn't reality around COVID. And that was even before the topic of vaccines came up. So because of this, I'm excited and humbled to share that we are partnering with the Black Coalition Against COVID-19 on a series of town halls to share relevant, tangible information about COVID-19 and the COVID-19 vaccines so that we could have our questions answered, discern between fact and fiction, and help our community, make some informed decisions. And so with that, I would like to introduce Mr. Ambrose Lane, Dr. Melissa Clark, and Dr. Reed Tuckson, who will be leading our session this evening. I'll soon turn it over to them to share a little bit more about themselves and the Black Coalition Against COVID. They have already received several questions from our families and will provide insights on COVID and the vaccines. And time permitted, we'll also be able to take questions through our chat feature on Zoom. And with that, I will turn it over to Mr. Lane, Dr. Clark, and Dr. Tuckson. So thank you all so much for being here and sharing your knowledge with us.
Thank you, Niels, and thank you to all of the participants and parents and those involved with DC Prep. My name is Ambrose Lane Jr. I am going to introduce Dr. Reed Tuckson, who is co-founder and really the brains behind the Black Coalition Against COVID. He is the motor that keeps us going. And we might sometimes be the oil and the gasoline, but he is the engine. And so to Dr. Reed Tuckson, who will share with you all the national perspective and picture about COVID and about vaccines. Dr. Tuckson.
Well, thank you very much. It's a real pleasure to partner with Dr. Clark and Ambrose Lane. We're brothers and sisters over the last year in this effort, and they'll talk to you certainly more about what we are at the Black Coalition locally. Nationally, the Black Coalition is also comprised, just so you'll know, of the 4 Black medical schools in the United States: Howard, Meharry, Morehouse, and Charles Drew, the National Medical Association, the National Black Nurses Association, and the National Urban League, and the largest Black health publisher, digital publisher, blackdoctor.org. The reason that I'm mentioning that to you, and again, as my colleagues will talk to you about the local, what we do locally, which is the majority of our work, the reason why I mention that to you is that I think it is important that you get a sense that we as people of color and those who care about people of color have to bond together in every way possible during this critical time so that we work together and leverage our knowledge and our assets and our resources to be able to try to overcome this. I cannot stress to you the seriousness of this moment. We have been at this now, obviously, for more than a year, and there is so much reason to be optimistic. There is light at the end of the tunnel. However, that light has to be earned. We have to do what has to be done over the coming 60 days if we're going to reach the light. If we don't do what we have to do over the next 60 days, I am very fearful that we will have a horrific time yet again. Why do I say that? I say it because of 2 reasons. Number one, we are seeing, actually 3 reasons. Number one is that we are seeing COVID fatigue starting to wear out all of our efforts in this country. We have irresponsible public officials throughout the nation who have declared victory somehow and that we all can go back and do whatever we wanted to do. It's all over. Everything is going to be fine, as if magic descended from the skies and will make it so. Well, there ain't no magic on this. And so those governors who are releasing the restrictions and telling people not to wear their mask and go ahead to restaurants and indoors, they're going to see a spread of this disease. And there is no magical fence walling off Mississippi, Texas, Florida from the rest of the country. So whatever happens to them happens to the rest of us eventually. The second reason why this is a serious moment is because of the variants. As we know, and we've all learned, the natural history of any virus is that over time, if it can survive long enough, it will change its behavior. It will change its structure. Sometimes those changes can make the virus more easy to transmit and can make the virus more dangerous. And that's what's happened here. There is a strain of vaccine now that came from the United Kingdom that is now become the dominant strain in the United States. So the strains that we fought before are now overtaken by this new strain, which is much more easy to transmit, and it is much more dangerous in terms of human health. And that is a real problem. We're also seeing other variants. And in fact, in several places in the country, we have combinations of variants that we are now being able to pick up through our disease surveillance. And so this says to us that we need to be very, very attentive to doing the things that we already knew we were supposed to do. And that's wearing our masks every time we go out, making sure we're not indoors with people that we don't know, making sure that we are practicing social distancing and common sense. And then the third reason why I'm concerned about where we are is that we are in a desperate race to get as many people vaccinated as possible so that we can overcome the pandemic before the variants spread and get worse in the days to come. I am worried about the vaccination effort because there still are very large segments of the population who, for varieties of reasons, and there are quite a large number of reasons that people have, are still making the decision not to get vaccinated. The more that happens, the more the variants can continue to grow, the more this disease will spread, and the more they will become immune to the vaccines that we now know are safe and effective and that they work very, very well. So I want to be very clear that as I start to pass the baton to my colleagues, that if, and I know you do, if you love children, if you want children to go back to school, then understand the single most important thing you can do to protect our kids and allow them to have safe schooling is to stop the spread of this pandemic in our community. You can't have both. So anyone who professes to love children had better be the first ones to make sure they're wearing their masks, they're social distancing, and they're in line to get vaccinated as soon as they possibly can. And now that the restrictions have been limited for who is eligible to get the vaccine, now you can go and get it done. And that is the moment now that you need to embrace so that we can have our lives back. And I'll finally say this, you can have your life back. You can have the barbecue for 4th of July. You can watch your children graduate the senior prom. They can have their dance. The kids can have their lives. We can go back to church indoors as soon as we just get done what we need to do over the next couple of weeks. So let's stay the course. Let's care about our children enough to do the right thing for them. Let's care enough about our lives to do the right thing. And if you have questions, which we now know you do, thank you for asking questions. Asking questions is the exact right thing. But please, when you ask your questions, ask them of people like Ambrose and Melissa who know the answers, but don't take the social media nonsense, the miscommunication and the misinformation agenda. Please do not ask them to keep spreading death throughout our community. I know that sounds harsh. We cannot allow mischief makers, proud boys, Russian bots, all manner of people who mean us no good to continue to spread nonsense. But for you who are sincere and want to ask questions and have doubts, it's quite fine to have doubts. Ask the questions and people will answer. But at the end of the day, I sincerely hope that you'll keep doing the right thing. So with that, I will turn to my colleagues and thank you for the opportunity to address you. Many of you may know I'm the former Commissioner of Public Health for the District of Columbia. And so I have a real passion for saving lives. And I have a real anger for those who would try to do things to kill us. I love this city. I love the people in this city. I love the children of this city. And it matters to me when people do things that would harm us. Thank you all very much.
Thank you, Dr. Tuckson, and I will follow. And this is why we follow Dr. Tuckson. He's the former Commissioner of Health for Washington, D.C., was here during the AIDS epidemic when a lot of these same issues came up in terms of things such as contact tracing. My name is Ambrose Lane Jr. As I said, I am a co-founder of the Black Coalition Against COVID, but here in the district, here in Washington, D.C., I am the founder and chair of the Health Alliance Network, which is DC's largest community-based health advocacy organization. And I'm just going to share with you what is happening in the District of Columbia. So in the district, we have had thus far over 477,000 people tested, DC residents. That is more than half of the population. The population of DC is 705,000 people. 47,000 people have tested positive, and there have been 1,098 deaths. We're coming up on 1,100 deaths in the District of Columbia. And something has changed a little bit in terms of even the deaths. Prior to, I'd say the last 30 days, most of the deaths occurred from people who lived in Ward 8. In fact, 75% of those deaths were African Americans of all the total deaths in DC. But right now, I can say that 207 deaths are from Ward 8, but close behind, there have been 199 deaths from Ward 5, followed by Ward 7, which is 173 deaths. Now, what is significant about that is that those are the three wards where you have the highest rates of chronic disease, the highest rates of disparity in the district. And that is why that is significant. We know that there are high rates of diabetes. We know that there are high rates of even obesity, overweight, hypertension, and kidney disease. All of these things are higher in wards 5, 7, and 8, particularly in wards 7 and 8. When it comes to vaccines, as Dr. Tuckson said, now anyone 16 and older is eligible to receive a vaccine. There have been 422,000 people, or 422,000 doses that have been administered. So what does that mean, 422,000 doses administered? Because now J&J vaccine is offline and the Moderna and the Pfizer vaccines require 2 doses. If you take the number of people in DC, which is 705, and you double that, it's 1,410,000. 1,400,000 people. That's how many doses you would need. So if you double the doses, because everybody needs 2, you would need to administer more than 1,400,000 doses. So having only administered 422,000, we're slightly less than a third of the number of doses needed to vaccinate all of DC. The percentage of people fully vaccinated in the district is 15.7%. And there are 30% that are partially or fully vaccinated. So those numbers bear out. In terms of who and some of the demographics, 35,000 Black people have been fully vaccinated. Another 26,000 have been partially vaccinated. In comparison, there are 42,152 whites that are fully vaccinated and 36,000 that are partially vaccinated. And here are some other interesting statistics. And this emphasizes the point that Dr. Tuckson made when we said how important it is for us to go and get our vaccine. When you look at the total number of those that are vaccinated by ward, only 9% of Ward 8 has been vaccinated. 9% of Ward 8 has been vaccinated. And when you compare that to Ward 3, 20% of Ward 3 has been vaccinated. And even when you break it down in terms of the number of seniors, those over 65 that have been vaccinated in Ward 8, there are only 2,934 seniors that have been vaccinated. In Ward 3, there have been 8,612 seniors that have been vaccinated. So Ward 3, which has a lower rate of positive cases, has more than double, triple the number of people that have been vaccinated. And that speaks to the early onset of the vaccine protocol, in which there were people coming from other parts of the city into Ward 8 and into Ward 7 to get their vaccinations. And so that spoke to much of the disparities in terms of the vaccination protocol. But it's very important as we deal with vaccine hesitancy and deal with the rollout of the vaccine, that we stand up, as the Department of Health stand up more community spaces and community locations in Ward 7 and Ward 8 to provide vaccines. And what the Department of Health is doing right now is working with community-based organizations and faith-based organizations and churches to be vaccination sites. Part of the work that Dr. Clark and I are doing in the BCAC is working with FBOs, faith-based organizations, and with community-based organizations to get them to be vaccination sites. And the more vaccination sites we have, the more people will get vaccinated. And so as the Department of Health begins to roll that program out, I can speak to several churches that are already vaccination sites, such as Pennsylvania Avenue Baptist Church and others that have been vaccine sites. And so this is important because as the Health Alliance Network worked with the Department of Health and the BCAC worked with the Department of Health, we interviewed residents from Ward 7, Ward 8, and other parts of the city to determine what are the issues centered around hesitancy. Why are people hesitant? And some of the information that came back was centered around, well, people would feel more comfortable going to a site that they are familiar with, whether or not that site is a church, whether or not that site is a community organization, or whether or not that site is a recreation center. And so these are important pieces of information that help us be more efficient in terms of being able to get people vaccinated. But I did want to stress that Ward 8 had the lowest rate of vaccination, which is only 9%. 9% of the whole population of Ward 8 has been vaccinated, and only 2,900 seniors. And so we know that there are more seniors in places like Ward 4, places like Ward 8, and we really need to stress how important it is to get a vaccine. The thing about the vaccine, and this will be area covered by Dr. Clark after I finish, the important part is that the vaccine is not a cure. The vaccine will prevent you from getting sick, and it won't prevent you from spreading it. So you can still get coronavirus, but you will not get sick and end up in the hospital in an ICU unit if you are already vaccinated. The other thing is that someone else who can come into your home who is not vaccinated can catch it from you, and they can get sick if they are not vaccinated. So it's important not only for you to not get sick if you catch coronavirus, it's also important that if you happen to catch it and you spread it to someone else who has not been vaccinated, they will get sick. And so that's why we emphasize and we stress the need to get vaccinated. And Dr. Clark will certainly talk about specifically the vaccinations, what's in the vaccination, and all of the safety measures that have been put in place. You may have heard that the J&J or the Johnson & Johnson vaccine has been pulled, But the reason that has been pulled is for your safety. The federal government through the CDC really is trying to make sure that the American people are protected, really trying to make sure that residents are protected. And they just want to check it out and study it a little bit more to make sure that it is completely safe for people to take the J&J vaccine. The other two vaccines that are on the market, the Pfizer vaccine and the Moderna vaccine, are completely safe. You have few side effects, maybe a sore arm, or you might have some fatigue or a headache. But by and large, those are the side effects. And so Dr. Clark will get into that a little bit more, but I wanted to make sure that those that are on this call understood that, number one, the Department of Health is pivoting to have a more robust vaccination system. They are utilizing and working with community-based organizations and I would assume that those are also schools. I know that Dunbar High School was a site for vaccinations for teachers. And so we have to stand up those sites that people are familiar with and comfortable with, and how we encourage people to get their vaccine so that we can be safe. And as Dr. Tuckson said, have that barbecue in July, have that Labor Day party, so that we are all vaccinated and we can get back to a life that is almost normal. We will still have to wear masks. We won't have to social distance as much, but we will have to wear masks. And we will have to continue the hygiene, such as cleaning our hands, washing our hands, and things like that. So those things will continue, but at least we'll be able to converse, we'll be able to be in each other's company, and we are social beings. And this is what we know, this is what we are socialized in. We love being in each other's company, and we want to get back to that. We want to get back to that level of normalcy. So without further ado, I'm going to now introduce Dr. Melissa Clark.
Good evening, everyone. I know this is a dinner hour, and I'm really glad that you all were able to join us tonight. You know, we've been at this for over a year, and, you know, we're still learning. And so what we're doing tonight is bringing you up to date on what we know, the latest of what we know, and we are here to answer your questions. So I want to really try to get through some of the things that we have to say so that we can leave time to talk with you, because I think it's really in you're getting your questions answered that people will have a level of comfort around the decision to take a vaccine. So Niels, if you wouldn't mind opening it up so that I can share my screen, I'd really appreciate that. And I have a few slides just to share with you, because I'm going to be going over with you the facts about the vaccine. Dr. Tuckson alluded to, okay, here we go. Hold on one moment. Here we go. So Dr. Tuckson alluded to, you know, some of the reasons why, and Ambrose did as well, some of the reasons why we as African Americans have legitimate reasons for not wanting to take the vaccine, or at least being concerned and wanting to wait and ask questions and be satisfied. And I am someone who advocates being health empowered. Actually, I wrote a book called Excuse Me, Doctor, and the whole idea was to help people know what questions to ask, that they should be asking questions, that they should be deserving the best healthcare that there is. And so I applaud everyone who's asking questions about the vaccine. And we know in the African American community, one of those reasons why we're distrustful has to do with the past, how we've been treated by the medical establishment, by the research establishment. And one of those things that is often cited is the Tuskegee Experiment, which was just really a horrific way that African-American men who had syphilis were treated, and or actually not treated, by not being given the life-saving treatment of penicillin. And we know that there have been other instances in history where that's happened. But I also think too that it's the way that we're often treated when we as African Americans try, or actually any Black or Brown community try to access the healthcare system, and we're often talked down to, or not heard, or perhaps disrespected. And for that reasons, the healthcare system has not earned our trust. We even see documented well in the medical literature that um, communities of color are less likely to get referred for life-saving treatments. And then finally, and I know Dr. Tuckson talked about Russian bots and trolls, social media has been a huge factor in spreading myths, half-truths, semi-truths, disinformation about vaccinations. They've been doing it since 2016. They first started off with the flu and talking about Hillary Clinton and Bill Gates being partnered to depopulate the earth using vaccines. And then once COVID and the vaccine came along, it got tweaked to say, oh, it was Anthony Fauci and Bill Gates who are depopulating the earth. The truth of the matter is, when you vaccinate children, they live to adulthood. And so therefore, against childhood diseases. And so therefore, children, families are able to make a decision, especially in countries where measles and polio and mumps, smallpox were killing children. Families were able to make the decision to have fewer children. And so that's the link between vaccinations, especially childhood vaccinations, and lower numbers of people in the population, because people choose to have less children so that their families can be more prosperous. So those are a lot of the reasons that are legitimate reasons to have vaccine hesitancy. And the medical establishment has to step up and earn our trust. And we have to, as people in healthcare, be more assertive about countering those myths that you're seeing on social media. And so I'm just going to hit on some of the points that I think we all need to know to be able to make informed decisions. The first is, what are variants? You know, Dr. Tuckson talked about variants, but it's pretty simple. When a vaccine invades our body, that's the only way it can live, is to have a host. And it turns our body into a virus-making factory. So in the instance of the coronavirus, it turns our body into a coronavirus factory. And in the process of manufacturing millions and millions of copies of coronavirus, there are going to be some slight changes that happen. And some of those slight changes are going to give the virus an opportunity to be more successful at hitting that next host. So it becomes more infectious. And what we're seeing with the UK variant that was mentioned earlier is that it appears to also make younger people sicker. So that's really an important thing to know. And is also, if you've had COVID because of the first strain of coronavirus, you can be reinfected with these variants. And then, what do you need to know about the vaccines? Well, there are three kinds of technologies that were used to make different kinds of coronavirus vaccines. The first is the Pfizer and Moderna vaccines. They use something called messenger RNA. Now, what is that? It's just the blueprint that is needed, the instructions that the virus uses to tell your cell how to make more virus. And in this case, it is only what's used for the vaccine, that instruction manual, it's only just for the little part of the virus called the spike protein. It's the piece of the virus that's used to anchor onto your cell and enter your cell. And so multiple pieces of that spike protein get made when you are vaccinated with the Pfizer or Moderna vaccine, so that your body can produce antibodies, which are your body's policemen or soldiers that are used to fight off infection. And the beautiful thing about the body is it makes these antibodies specific to the coronavirus, so that if you then get exposed to the coronavirus, your body is ready to be ramped up and immediately take down any coronavirus that enters your body. So that's the Pfizer and Moderna. The next are the Johnson & Johnson and the AstraZeneca. AstraZeneca is still being studied in this country. As you know, Johnson & Johnson was paused, and I'm going to get to that in a moment. But the main difference is that it uses DNA, which is another type of instruction manual or blueprint for how to make virus. And again, it just uses the DNA to make the spike protein so that your body can react to it. And then the third type of technology is it doesn't involve any instruction manual or genetic material at all. It's just the spike protein that gets put into the vaccine and enters your body, and your body directly makes antibodies against that. And that is the technology that the Novavax vaccine, which is still being studied. Howard University is actually one of the sites where that's being studied. Do the vaccines work? Yes, all three of them that are authorized work and are extremely effective at preventing you from getting severe COVID and dying from COVID-19, actually 100% effective in doing so. And the difference, the reason why there's some difference that we see in those numbers of effectiveness has everything to do with the fact that the Johnson & Johnson vaccine was tested in South Africa and Brazil, which are where some of the most powerful variants are, the ones that are the most infectious. And so it was tested against those. It's sort of like it entered the ring against Muhammad Ali versus against Pee Wee Herman. So it took more, blows to the body. And so therefore the numbers, the effectiveness numbers are slightly different than Moderna and Pfizer. And then I'm going to skip over this slide in the interest of time. I won't hit all the points, but I just do want to say that, the speed of the development of the vaccines had to do with the fact that, number one, that technology that I mentioned about using mRNA and DNA pre-existed the pandemic by like 10 years. And so they just took that technology off the shelf, applied it to this, to the making the COVID vaccine. And that's why we were able to have a vaccine in a record time. And so what's up with the Johnson & Johnson vaccine? Why was it paused? Well, the first reason is that the main reason is that 1 in a million individuals who received the Johnson vaccine developed a rare blood clot, it's a blood clot in the brain called the cavernous venous sinus thrombosis. That's the fancy name. It's basically a blood clot. So that 1 in a million, or basically 6 women out of 6.85 million vaccines given, were women aged 18 to 48. Of note, if you take oral contraceptives or birth control pills, if you've been pregnant, or if you are pregnant, or if you have COVID-19, you actually have a higher rate of developing the same kind of blood clot, much higher than 1 in a million. The other thing to keep in mind too is the FDA and the CDC, which are the organizations that watch out for public health and watch out for medicines and vaccines and their effects in the population, have been keeping an extremely close eye on this. And they were the ones who, out of an abundance of caution, not because we know for sure that the J&J vaccine leads to these blood clots, but just in case it does, it's giving people time to know what the symptoms are to look out for. And number two, to let doctors know how to treat it should they see this complication. And so just so you know, if you have received the Johnson & Johnson vaccine in the last 3 weeks, if you develop shortness of breath, abdominal pain, leg or arm swelling, or severe headache, those are reasons to seek immediate medical attention. And then finally, we've had over 200 million doses of vaccinations given. And the only serious known side effect that we've run into are the severe allergic reactions, which you might have heard about. And those are extremely rare, 11 times for every million vaccines given. And they've all been successfully treated. Other things to know. You probably, if you're under 55, will probably get fevers, chills, aches, fatigue, or some combination thereof after you get vaccinated. It lasts for about 24 to 48 hours. It's more common in people under 55. And it really just means that the vaccination that you received is revving up your immune system like it should. Those are the effects you experience if your body is getting revved up. And the reason it happens in younger people is because younger people's immune systems are more aggressive than older people as we age. And then I mentioned the vaccine side effects. Rashes do happen occasionally, very rarely. They tend to be harmless. And if they happen in the first 4 hours, that's an allergic reaction. If they happen after 4 hours, they tend to be not an allergic reaction and not a reason to not get the second dose of vaccine. If you have underlying health conditions, not a reason to not get the vaccine. Always great to talk to your healthcare provider if you have questions about your particular concern. But in all the clinical trials that we've seen, the vaccine was as effective in people with underlying health conditions as it was in those who weren't. And then finally, with the issues around disinformation, there's a lot of stuff circulating on social media around, does the vaccine make you sterile, or does it affect your DNA? So when the genetic material gets into your body, keep in mind that we have been exposed to viral genetic material our entire life. Anytime you get a cold or a stomach flu, you're exposed to viral genetic material. So it's nothing that we have not encountered before. Number two, that vaccine material, that's the instructions, the genetic material in the vaccine, it gets destroyed within minutes of entering your body. So there's no way that it actually can affect your fertility or affect your DNA. And it definitely does not cause COVID because it's only the very small part of the vaccine that's getting introduced into the virus that's getting introduced in your body. And that's me. I took the vaccine. I had it, both doses of the Moderna in January, actually December 31st and January 28th. I did have the side effects after the second dose. They passed in about 24 hours. I've been fine ever since. And I close my eyes because I hate getting shots. So, and then I just want to leave you with two things. A lot of people say, well, I'm healthy. I'm good to go. I take my vitamin C, I exercise and every day. That's great. And these are the 5 self-health actions that I say that we all should be doing as much as we can and is within our power to do in terms of eating nutritious foods, staying hydrated, moving every day, getting enough sleep, and managing the stressors in our lives so we don't feel overwhelmed, whether that's with exercise or prayer or with a hobby or with dancing or meditation, however you do it. We should all be focusing on that. But the fact of the matter is, it does make us healthy, but it doesn't necessarily teach our bodies how to respond to COVID-19. That's what vaccines do. So I know you all know about pop quizzes. I'm sure they have them at DC Prep. So imagine you don't know you're going to get a pop test the next day, but somebody comes to you the night before and gives you the answers to the test so that the next day you're able to ace the test immediately. Well, that's what the vaccine does. So no matter how smart you are, i.e. how healthy you are, it always helps for somebody to give you the answers to the test the night before so that you are well prepared when you get to that test to be able to get 100%. And then once you get the vaccine, the things that you can do safely, you can hug others who aren't vaccinated without a mask, others who are vaccinated without a mask. You can have social gatherings like the cookouts that we talked about by 4th of July with others who are vaccinated. You can even visit with another unvaccinated household. No need to quarantine if you are exposed to somebody with COVID-19. And finally, and I should say that is if you don't have symptoms. If you have symptoms, of course, you should quarantine. And then finally, you do still need to wear a mask and distance around those people whose vaccine status you don't know. So I'm going to stop there. Hopefully I've left some time for any questions that you might have. We're happy to take them now.
Dr. Clark, thank you so much. And thank you, everyone. Mr. Lane, and I know Dr. Suxon had to hop off. Thank you all so much for presenting to our community. All right, families, friends, if you have questions, please put them in the chat. I do have a few that have came in. But yes, if you have any questions, please feel free to put them in the chat.
While we're waiting for questions, I just wanted to underscore that as of this past Monday, everyone 16 and older is eligible to get a vaccine. And Pfizer, the company that makes, for 16-year-olds and 17-year-olds, they can get the Pfizer vaccine. That same company has now applied to the FDA to extend that to 12-year-olds because they've been doing tests, and apparently the tests have been successful. We have not yet seen the data, but once that is released to the public, we'll be able to look at that and verify whether it does show that it is indeed safe. And then thereafter, 12 to 16-year-olds, 12 to 15-year-olds can be added to those numbers of people who are eligible.
And right now there is testing going on to be able to develop a vaccine for under the age of 12 and for pregnant women.
Great. So one of the questions that came in is how often will we have to get vaccinated? I'm assuming it's like once you've already been vaccinated. In the future, how many additional boosters will we need to receive?
We don't know yet. That is, we're waiting to see that. We do know that Pfizer has come out with their interim results of being able to see that after 6 months, people still have immunity after being vaccinated. So that's the floor. So they're still going to be following people after that to see how long the people who are in the original trial continue to show that they have immunity. So we'll just have to stay posted and listen out to see how long that's going to be. But there is a strong chance that we may need a booster in the future. That research is going on right now.
Dr. Clark, this is a fun question. I'll try to simplify what they said. So the question in the core of the question is, is there a vaccine that is better than the others? And in particular, if I had a choice, which one should I go for? Just to color it in, an additional part of that question is there one that will make the second shot less, the side effects of the second shot easier compared to the others?
That's a great question. So the reason, again, while we get those effects, it means that our bodies are revving up, are producing antibodies. So it's actually, I know it's uncomfortable, but it's actually a good thing because it lets you know that your body is responding as it should. No, basically Pfizer and Moderna are about equal, and J&J are all equal in those side effects, because again, it has nothing to do with the vaccine itself. The company that makes it, it all has to do with your body and your body's ramping up and producing antibodies.
I believe you already answered this question, but maybe just a reminder for everyone. This is specifically for mothers who are pregnant or breastfeeding. What is your advice or suggestions on whether they should get vaccinated and how long they should wait to get vaccinated if they should?
So let's talk about mothers who are breastfeeding. We know that antibodies that you make as a result of getting vaccinated with the coronavirus actually enter breast milk, and your baby benefits actually from your antibodies. So there's actually no recommendation to wait if you are breastfeeding. It's actually beneficial. From the standpoint of getting vaccinated if you're pregnant, the OBGYN group in the United States, is called ACOG, came out with a recommendation that women who are pregnant should have access to the vaccine. Now, the trials, as Ambrose mentioned, are still going on because typically we don't, we meaning in the scientific community, do not test treatments on pregnant women and children first. Typically it's on adults, non-pregnant adults. So that was done. And so now is the time where we're looking at, how does this work in pregnant women? But in the meantime, OBGYNs have been advising pregnant women to get vaccinated because pregnancy by itself may lead to severe cases of COVID if you get infected with the coronavirus. And so the risk, any risk of the vaccine, is much less than the risk of coronavirus to a pregnant woman. And so for that reason, many OBGYNs are suggesting to their patients to get vaccinated.
And the other piece to add to that is that there have been women who've been pregnant that did get the vaccine, and it did not have any kind of effect on the fetus, did not have any kind of effect on the mother.
So actually over 15,000 women have been vaccinated, pregnant women have been vaccinated. As a matter of fact, the day that I got vaccinated, there was a 9-month pregnant woman sitting right next to me. And so they're following those women to see, have there been any side effects? And to the date, there has not been.
Great. We currently have 2 questions left. And again, if you have everyone, if you have any questions, feel free to use the chat feature. This question is, can you speak more on the speed of the vaccine, on the speed of the testing for the vaccine? I guess the question is speaking around, like, it seems like it was fast to make the vaccine. And so we could speak towards like all the things that took place in order for the vaccine to be approved.
So keep in mind, as I mentioned, that the technology pre-existed COVID by about at least 10 years. The technology, that DNA technology that I mentioned around that Johnson & Johnson and AstraZeneca use, has actually been successfully used in other vaccines. The Pfizer and Moderna vaccine, that technology has been around for at least 10 years, and they were able to pair it with the coronavirus to be able to produce the vaccine. So it's not like they started from scratch. They had a significant head start. And then the other thing that I also say to people, if you have a smartphone or an Apple Watch, you're benefiting from the rapid development of technology. It used to be that not so long ago, the computing power that is in your Apple Watch and your smartphone needed an entire room to hold it. And it's through the use of nanotechnology, which I know gets thrown around in the memes and the social media posts to scare people, but nano just means little technology, the ability to work in small spaces. So taking all that computing power and shrinking it down into your watch is the same process that they were used to come up with these advances in vaccine technology.
And then
I don't know if people remember the MERS virus, MERS, which was the Middle Eastern virus. A lot of the technology that we're using now was developed from trying to treat the MERS virus.
The last question of the night, and I'm gonna summarize the question. It's essentially around how do we know if the vaccine was tested and supported on Black people? Are there more intense side effects for Black people? Essentially, what is the case that we know this vaccine will be efficient and effective specifically for our community?
So I wanted to add one last thing to the last question. Billions and billions of dollars, hundreds and hundreds of the best scientific minds around the world went into getting us to where we are in terms of developing the vaccine. So that's another factor in how long it took for us to come up with a vaccine. As far as Black people, so for the Pfizer and Moderna vaccine, that was tested in roughly about 78,000 people. And about 10% of those so roughly the population of proportions in the United States were really 13% of the population, but about 10% was Black people. Of the Black people in the study who got the vaccine compared to the people who got placebo, like sugar water, not the real vaccine. Of the people who got the vaccine who were Black, 100% of them did not develop COVID. The overall effectiveness was 94 to 95. So it's actually, I won't say it was more effective in Black people because the numbers weren't large enough to say that, but I think that's important to know. Secondly, with the Johnson & Johnson vaccine, because it was tested in South Africa, which has a majority Black population, that was one of the places it was tested. It was also tested in Brazil, which also has a large Black population. They actually had larger numbers. They had 15% of their study population, which was close to 40,000, were of African descent. And so, again, it was found to be extremely effective in that subpopulation of the study.
Dr. Clark, Mr. Lane, Dr. Tuckson, thank you all so much for taking your time to speak with our community. I know when I was first considering the shot, I was extremely apprehensive. And after spending 5 minutes on the Black Coalition Against COVID-19's website, listening to maybe 3 of the videos, yeah, it was a simple decision for me. And I'm very glad that I took the shot. Thank you all so much for your time. And I know I'll speak on behalf of DC Prep, our staff, our students, our family, our extended community, that we really, really appreciate it.
Well, thank you, Niels. And thank you for mentioning the Black Coalition Against COVID website, BCAC.org. Please visit it. There are tons of resources there. We hope that you do that. And thank you so much for the wonderful questions and for having us here tonight.
And it was our honor, our pleasure to present in front of you. Thank you.
All right, everyone, have a good evening. Take care.
All right.
Bye.
Take care.